Yeah, so hi everyone, my name's Rosa. I'm a PhD student based at the University of Oxford, and it's a pleasure to be here alongside so many people talking about so many interesting things today. In my PhD, I'm exploring experiences of managing postnatal blood pressure. But today I'm actually here to talk to you a bit about a piece of work that looked at the use of home fetal Dopplers. And I know this is a slightly left field topic to bring to an APEC conference, but I hope that what I'll share will feel interesting and relevant, especially when thinking about kind of self-monitoring practices during pregnancy. So as I'm sure you're all aware, there are many devices or pieces of tech that are recommended or used during pregnancy that allow people to self-monitor their health and by extension, gain insight into the health of the fetus too. And these include things like apps to track symptoms and of course things like blood pressure monitors. And self-monitoring blood pressure in the home environment is a really important practice in research and care around blood pressure during pregnancy. It's something that's actively encouraged, and trials have showed that it's safe and acceptable for pregnant people. And it's also something that allows people to feel in control and empowered when managing their health and in clinical encounters, albeit alongside concerns about how this could responsibilize patients in their own care or increase health anxiety, as well as potentially adding some additional burden for healthcare professionals' additional workload. Fetal Dopplers, on the other hand, are a medical device that have also found their way into non-clinical settings, but the discourse around this piece of technology is quite different to, for example, blood pressure monitors. So fetal Dopplers are handheld devices that use ultrasonography to detect and amplify the fetal heartbeat, and they're frequently used by healthcare professionals to listen in. And for example, at regular midwife appointments, they're also widely available on the commercial market at very different price points and qualities. So you'll see the sort of middle image on this slide is just a screenshot from a search on eBay, where you see prices ranging from £7 to well into the hundreds of pounds, used, new. The devices look very different. And they're marketed as allowing pregnant women to listen to their unborn baby's heartbeat at home and at any time. And unlike home blood pressure monitors, there's no evidence that Dopplers used in this way improve outcomes for mother or baby. And there's very little research on how they're actually used and any impacts that this may have. And in fact, as some of you may know, there are quite significant concerns about the safety of these devices when used outside of clinical supervision, as there have been a couple of quite high-profile cases of pregnancy loss after getting false reassurance from using a Doppler at home, where seeking medical care was delayed because of this. And as such, guidance from the NHS, the RCM, as you can see from the other screenshots on this slide, and a few other organisations really strongly advise against the home use of Dopplers. And our interest in this topic came from discussions during our priority setting partnership on women's health technology that happened in 2022. And this highlighted some potential tensions between the lived experience participants who were interested in knowing how and when to use home Dopplers, and midwives' concerns about the proliferation of these devices and the challenges of talking about them in clinical settings. So as I mentioned before, there's very little research that explores people's experiences of navigating home Doppler use or on clinician perspectives on this practice. There's one qualitative study that found that some women use Dopplers to sort of manage anxiety related to pregnancy following challenging past experiences, but we wanted to just broaden this evidence base a little bit more. So the aim of this study was to explore patient and healthcare practitioner perspectives on home Dopplers and to identify ways these devices might interface with healthcare, and also how people's experiences could be reconciled with clinical practice to better support pregnant people. And to do this, we conducted semi-structured interviews with 20 people. So 16 of those had ever used a home Doppler during a pregnancy, and 4 of those had never used a home Doppler during their pregnancy. And people could take part if they were aged 18 or over, they lived in England, and they'd been pregnant in the last 5 years. And in the end, the people who took part in our study were aged between 25 and 43. 80% of the sample was white British. The other ethnicities in the study were Asian British, Black Caribbean, and other white ethnicities. We then conducted a series of interviews and focus groups with 15 healthcare professionals that included 1 obstetrician, 4 GPs, and 10 midwives. And we asked them to reflect on the findings from our participant interviews and to share their perspectives on what they'd heard. And all this data collection took place between August 2023 and May 2024. And after this, we conducted a thematic analysis to generate some themes from our data, and that's what I will share now. So yeah, I'll tell you about some of the findings. So devices were typically obtained through online marketplaces, new or secondhand, sometimes as gifts. and information about the use and safety was also found online. And people tended to use Dopplers kind of earlier in the pregnancy, so in the first 2 trimesters, and frequently before they could actually feel any fetal movement. This was often kind of a fun, social activity to support bonding for partners or other family members, but this could also be used for reassurance in the earlier stages of pregnancy. And Dopplers were also used to allow people to feel more in control, often when access to care in the form of appointments or scans felt a bit more limited, as this one person said who'd used the Doppler. So there's a gap between your 12-week and your 20-week scan where you have very little contact with any health services. The first trimester is sort of gone, and so has the sickness in my case. And then you're also not yet feeling movement. So for me, Doppler usage was mainly in a few weeks in there. And the same was true for managing anxiety related to the pregnancy, particularly in response to any challenging past experiences, such as previously having had a high-risk pregnancy or a pregnancy loss. And for many people who used home Dopplers, accessing care or escalating concern and using the Doppler were not seen as mutually exclusive. So as this participant said, I thought, if I have a lot of worries, I'll still go to the hospital, but I'll also have the Doppler at home just for peace of mind. So they were quite aware of guidance that using the devices was not a replacement or alternative for seeking urgent care for reduced movement. But still, there was this element of just in case and peace of mind. And the awareness of the guidance against Dopplers could also inform people's decisions not to use them, although this could still be quite a hard decision. So one participant who decided not to use a Doppler said that after having a previous pregnancy loss, it was, to quote, really hard not to go and do it. So our participants, both the people who used and didn't use Dopplers, developed quite nuanced understandings of kind of acceptable and unacceptable home Doppler use. So within their accounts of decision making, there was a sort of moral framework which differentiated the right from wrong reasons. And these right reasons were usually kind of generally framed as social, so using for emotional bonding or fun, whereas these wrong reasons were seen as more medical, and that would include seeking kind of reassurance for reduced movement, and could therefore be seen as a bit more risky. But the boundaries around these framings of right or wrong reasons were actually quite porous, and they coexisted quite blurrily for people. And I think that's highlighted in this quote from participant 5, which says, I was probably quite hypocritical because I was thinking, these shouldn't be on the market for anyone to buy. In the wrong hands, they can be unsafe. But the thing with that was I was still going to use it. And the kind of moral delineation between right and wrong reasons really reflected participants' awareness of the kind of stigma and perhaps judgment around Doppler use, given the fact that they were really, their use was really discouraged. And we heard how this sort of contributed to the construction of home Dopplers as a taboo subject. And this quote from the participant kind of shows that. I didn't tell any medical professionals what I was doing. Not that I was actually hiding it, but I just wouldn't have mentioned it. The same thing applies because I knew there would be an element of judgment. So often people didn't actually disclose their use of Dopplers to the healthcare professional or wouldn't ask questions if they were curious about them. And if they did raise the topic of Dopplers, at times people were met with what they felt was quite a harsh, no, just don't use them. There's sort of no excuses, with little other explanation. Although we did hear from some people who described quite positive experiences with healthcare professionals who were non-judgmental, who discouraged use but were conveying their understanding of the person's situation and thinking about alternative routes for reassurance. So people also described how feelings of anxiety were really deeply entangled with the use of these devices. So for some, home Dopplers provided real relief from anxiety, but for others, use actually heightened anxiety, and this could lead to either increased or decreased use. So some participants also described that while Dopplers increased their anxiety, they actually found it quite difficult to stop using. And this quote here highlights kind of a key sentiment that some participants had with a lot of anxiety around whether or not they could find the heartbeat. And for this person, it was leading her to question whether or not she should be using the Doppler. So she said, first, I didn't really find anything, so that escalated my anxiety. And then I thought to myself, I'm not really medically trained. I don't know what I'm looking for, and that could be a placenta flow. I was thinking to myself, should I be really using it? And yeah, some people would simply interpret this as not having the skill to find the heartbeat, whereas for others, this would cause quite a lot of anxiety around not actually being able to find it. And so now I'll talk a little bit about what came out of our conversations with GPs, obstetricians, and midwives. So the key concerns that healthcare professionals spoke about kind of aligned with the guidance on home Doppler use. So they were worried about people getting this false reassurance and delaying care seeking as a result. And midwives in particular had concerns about the untrained use of Dopplers because they felt like it would be difficult or perhaps even impossible for lay people to use a Doppler and interpret it to the extent that they would themselves, which was another kind of interesting slight mismatch with the lived experience where midwives kind of expected that people wouldn't be able to go into the nuance of the Doppler output, but in fact, people weren't looking for that. They were simply looking for the presence or the absence of a heartbeat. And healthcare professionals also had their own kind of tensions surrounding Doppler use, so that they're balancing compassion for their patients, where they really empathized with the anxiety and desire for reassurance that people had, but they were balancing that with professional guidance that discouraged Doppler use, which I think is really exemplified in this quote from a GP. The GP said, "I think that's a massive problem because patients want to make their clinicians happy. And so even if you tell them not to do it, they're going to go and do it. And then if you're doing it in an unsafe way, I'd rather you were doing it in a safe way. So it's making sure that you consult without judgment, but also maintaining your kind of professionalism in terms of what's safe to be recommended. It's so tricky, isn't it?" And while some of our participants expressed a desire for healthcare professionals to show them how to use Dopplers safely, so essentially a kind of harm reduction approach, healthcare professionals expressed quite strong fears around litigation. For example, if they were to show someone how to use a Doppler and this resulted in any negative outcomes. So this wasn't described as something that anyone had ever done, although healthcare professionals were sympathetic to people's situations. And in interactions with patients, many actually avoided discussing Dopplers altogether as they were seen as a kind of can of worms, challenging topic with few solutions. And so with both parties potentially not discussing home Doppler use, we were seeing how this could lead to sort of missed opportunities for addressing underlying anxieties that might actually be driving the Doppler use and for providing the best support for pregnant people during their pregnancies. And this complexity kind of sits alongside issues like a lack of time in consultations, and lack of resources to provide more support for pregnant people seeking reassurance. And these kind of practical challenges were flagged by a number of the healthcare professionals we spoke with as well. Before finishing up today, I wanted to just zoom out a little bit, and I do sort of do a bit of work in medical sociology, so it's like a little bit of that. But just to talk about Dopplers in the context of pregnancy surveillance and the responsibility therein. So we know that kind of monitoring the maternal body or the fetus is really a way to manage risk during pregnancy, and people in their bodies are often under quite intense scrutiny during this time. And monitoring is therefore seen as quite a favourable behaviour, and there can be immense pressure on mothers to ensure the well-being of their fetus through doing things like this. And so pregnant people are navigating quite a complex landscape of responsibilization in this way, where they might feel compelled or have the desire to surveil, monitor, listen in, but also worry and actually face judgment and repercussions of doing this in the wrong way. So, for example, by using Dopplers. And the stigma that can be associated with using Dopplers like this is really in tension with their ready availability. So commercial markets are really quick to step in and exploit these kind of anxieties associated with pregnancy. And in the case of Dopplers, kind of potentially provide misleading messaging about what reassurance these devices can actually provide. And there's also very minimal regulation of Dopplers. And in this current system, the responsibility there is really placed on pregnant people to navigate what is safe and appropriate Doppler use, which puts them in a potentially compromised position. And speaking to how people navigate Doppler use, there's also kind of broader discourses around autonomy, bodily and otherwise, and paternalism in medicine that came up in multiple accounts from our participants, including from those who chose not to use a Doppler, like this quote I've put here. And I just thought that was important to acknowledge, where someone is talking about the importance of listening to people and allowing them to do what they want with their bodies. So just to conclude and sort of summarize, I think the case of at-home Dopplers really highlights some tensions between reassurance, risk, and responsibility in pregnancy care. And we heard about how both pregnant people and healthcare professionals find them a challenging thing to talk about. But we can also see that not creating space to have these conversations could risk missed opportunities for navigating alternative routes for care and support. And on the interactional level from this study, we think it's important to reinforce the idea that having open, non-judgmental conversations about Doppler use is a really great starting point. And I haven't got it on this slide actually, but also kind of better aligning guidance with people's lived experience will be really important. So many of our participants had used Dopplers before feeling fetal movement. And a lot of the messaging around Dopplers is to count kicks and monitor fetal movements instead of using a Doppler. So you can see how there's slight misalignment there. And at a more macro level, I think considering greater regulation around at-home Dopplers and improving the evidence base around their use is really important. Um, so yeah, I think given the sort of prevalence of blood pressure monitoring, I think it's really interesting to consider other home monitoring technology that's used during pregnancy, particularly in pregnancies that could be more complex, or cause more anxiety for parents, such as those considered high risk, or for people who've had challenging past experience. So I hope you find it interesting to hear a bit about Dopplers, and I'd be really curious to hear where you think there might be parallels or crossovers with your work or other areas of pregnancy care. So yeah, thank you for listening.
Rosa, thank you. That was very clear and
Mm.
a very, very important area.